Lupus is what's called an autoimmune disease, and this is a condition where the immune system, rather than just protecting the body against viruses and bacteria as it normally should, it's also mistakenly identifying the body's own tissues as foreign invaders. So it's creating this response, which can then cause inflammation and damage in the body's tissues, and that presents a wide range of possible symptoms. So many people with lupus will experience things like extreme fatigue, which is a tiredness that doesn't go away no matter how much you rest. You'll experience joint pain and swelling, muscle pain and weakness, hair loss, rashes, often that are sensitive to sunlight. And it can also cause damage to the body's organs. So many people with lupus may have things like kidney involvement, lung involvement, heart involvement, or even brain involvement. So it's a really, really varied condition with no two people experiencing the same set of symptoms. And it's a very serious disease for many people.
I think a lot of us have, financial concerns primarily, like how do you keep body and soul together? And just earning money to make your rent, buy food, especially because maybe you would go to Lidl or Aldi to get your shop and now you have to order things in, use Deliveroo more, all of that kind of stuff. And then on top of that, this has definitely been a concern for me, getting in touch with my primary healthcare team, so my rheumatologist, my GP, actually being able to speak to somebody on the phone has been really difficult. Getting my blood tests monitored, even getting my medication, there's been a whole rigmarole around that. So it's been a real challenge. And I know I'm not alone. I've spoken to a few people who've had similar difficulties. I think a lot of us are just concerned of if things are really safe for us to go back to work. I don't think COVID-19 is aware that shielding ended on the 31st of August. It doesn't work like that. Things are not any less dangerous just because we as humans decide that, a certain date has passed and people need to go back to work. So I think we're all quite concerned about that. And the messaging keeps changing. Things keep flip-flopping back and forth. And I think for a lot of us, we just want to know that our safety is being considered and really thoroughly thought out. I am quite a hermit anyway, so it hasn't been that much of a change for me. I freelance, so I do a lot of different jobs and a lot of those jobs are online. And so I was working from home anyway. It has been difficult not being able to see friends and family and have, my normal support network being quite actually distant from me physically. And then, on top of that, it's like you're just kind of quite scared. You're scared to pick up the post in the morning. You're scared to go to the shop. There's just a lot of risk involved. And I think for me, what makes me quite annoyed is seeing people not take this disease seriously, because I have no choice but to take it seriously. So I get frustrated with that.
So I think the first thing to consider is whether somebody actually needs to return to the workplace. So if they have a role that can be done remotely from their home, then you should do everything that you can to support that employee, because that's going to be the safest thing, not just because they can avoid transmission of the virus in the workplace, but also on the commute if they rely on public transport and measures like that. I think we know that not every job is able to be done remotely, and therefore there will be some people who will have to return to the workplace. And that should only be done after a proper risk assessment is in place to check that that role and that work environment are COVID secure. So it may be that some people who are more at risk from the virus, like those with lupus, will need to have their roles adjusted slightly, or it may be that they need to be relocated to a different work environment where they have less contact with others. And those could be ways to safely return someone. But we also know that it's not going to be safe to return everyone to every role at the moment, especially with the rate of infections increasing. So in those cases, we're really hoping that the employers will do the right thing by their workers and continue to support them to stay at home, using things like the job retention scheme, the furlough scheme from the government, and the job security scheme after that, so that people with lupus who can't return safely to the workplace right now will have a secure income and will be able to return when it is safe on a later date.
I think the main thing for most of us is to keep doing what we're doing. Lupus patients are already really good at being hygienic just because the nature of our disease, the drugs that we take mean that we are automatically more vulnerable to things like coughs and colds and other lurgies. So I know I definitely had a stock of anti-bac even before COVID came on the scene. So I think that maintaining those protocols is essential, making sure we have enough masks, and also just being really good with our boundaries around where we will and won't go, who we will and won't see. You know, there's no point in kind of bowing to the peer pressure of going to an event or a birthday or some kind of public space where you're not going to be safe. Similarly with visitors, you know, if it's not going to be safe, if somebody's just been on holiday, I think it's important, and I've had to do this and say, you know, I'm going to see you after 2 weeks after it's absolutely certain that you're not incubating anything. And unfortunately, that's just the reality of the times we live in now.
Back in March, when this all kicked off, we were inundated with telephone calls to our helpline from people needing more clarity about the guidance and understanding their risk. And we've put out a lot of information, which has been regularly updated over the months. And we're really pleased that many people with lupus now definitely seem to understand their risk and are taking the precautionary measures that they need to. I think that we've had to adapt a lot of what we do because our usual ways of having patient events like education events or support group meetings aren't possible with social distancing. So we are now moving into a digital age for the charity. We're providing more in the way of virtual support group meetings. Some virtual education events are coming hopefully later this month. And we've also had to introduce a new emergency assistance fund to help support those who have been most financially impacted and are experiencing hardship. So we've been providing cash grants, and so far in the last 6 months we've awarded just under £23,000 to help support those families and individuals affected by lupus. Lupus, like many health conditions, is invisible for many people. So you can't know who is going to be more at risk from coronavirus. And therefore, it's absolutely essential that everybody is following the guidance with social distancing, with wearing masks, with keeping their hands clean, respecting others, because you don't know who's going to be more at risk, and we need to protect each other.
I think it's important to note that the data around COVID is, you know, revealing time and again that COVID is affecting people from Black and ethnic minority backgrounds or people of colour. And a lot of people with lupus, Paul will be able to probably give you more accurate data than I can, but, you know, a lot of people with lupus, the data shows that Black, African, Caribbean and Asian people disproportionately suffer with lupus. And I think what that tells us is that we have to be really, really careful as a community. I'm a mixed race person, and be more aware about how we are protecting people in our communities who have chronic illnesses.
People can come to the Lupus UK website, which is www.lupusuk.org.uk, and the charity is also on all of the social media sites where you can contact us directly.